Hey Staten Island, this is Healthwish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Today, from the Craft House in Killsborough Brew Pub, we conclude our visit with Staten Island University Hospital's Chair of Emergency Medicine, Dr. Nicole Berwald. We asked Dr. Berwald why she chose medicine as a profession and emergency medicine as a career. Give a listen.
A little bit earlier, you were saying that you don't have anybody medical in your family. So what drove you to pursue the field? When did you know you wanted to be a doctor? And take us through that story.
Yeah, so it's actually interesting. When you go to medical school, there's definitely the group of people who were exposed to medicine in their life and those who weren't, and how people got to the path is highly variable. I thought it appealed to me as a kid as far as what my inclinations were towards science and math, as far as the type of learning that you think you would build on to end up in medical school. And I did a lot of, outreach when I was a kid, things in homeless shelters and food pantries, and volunteered at the nursing home after school and painted the elderly's nails so they had nice nails. And did like little projects and things like that. And it sort of all comes together this way. But because I didn't really understand what it would look like, I did a lot of volunteering. And I volunteered in hospitals too. And I spent time in emergency medicine as a volunteer. And I spent time on a pediatric cancer unit as one of the places I did some of my volunteer work. And a few other things where you just sort of have to look and learn and see would you see yourself fitting in there. And I would say this to my kids or anyone else who's young who's trying to figure it out. You just have to do your best guess. And if you're wrong, your decision doesn't have to be permanent. You should just use the resources you have to make the best guess for yourself. And I think I did a little bit of that, but I wasn't sure. Right. And when I went to medical school, there were some kids who showed up the first day. I'm going to be a pediatrician. I'm going to be an orthopedist. I was like, I think I still want to be a doctor. Yeah. and I'm not sure what that looks like exactly for me. And there are ways of figuring it out along the way. And my exposure in medical school, and specifically once I got to emergency medicine, I was sold.
So what was it then? What was it about emergency med versus some of the other disciplines you were exposed to that said, this is it, I'm staying here?
So there's something very special as a physician with emergency medicine. And as a patient and as a consumer of health, I think most people can relate to this. Sometimes when you go to the doctor, you're going for your checkup, right? You're going for your well visit. If you have high blood pressure, you're going to have your blood pressure checked. If you have a problem that requires routine quarterly blood tests, you're going for that, and you're sort of marching the path of the problem you have. When you go to the emergency department, it's because something is happening then, regardless of what it is. It might be that you dropped a can of beans on your toe and your toenail's falling off, right? It might be that you can't move your arm and there's some bigger, more important problem going on. But whatever it is along the spectrum of acuity or how impactful it will be for the rest of your life, it's happening then. So as a physician, you're always dealing with something that's happening to that person then. And that doesn't happen in the rest of medicine the same way. And I like dealing with the thing that was happening then, regardless of how big or small that problem was. And you just sort of learn those things about yourself.
Right, and something to it happening then, more often than not, it's happening for the first time, right? So, you're being that person, you're being the person to take care of somebody at times in their biggest hour of need. I've never experienced this before, please help me. And I'm sure there's something super powerful, or personally fulfilling for that
yes.
Interaction.
Absolutely. And, and it falls on the loss of not knowing your patients in a longitudinal way and truly getting to know them, right? So when I walk into my family doctor that my sisters go to, that my parents go to, and they know everyone, I don't get that, but I get what you're describing. So it's a trade-off of things, of the relationship. And there's also has to be some inherent quality in the physician that you think you can bring to that moment that you describe. I like to hope when the patient's having that and I walk in, that I can create a scenario where they feel comfortable telling me those things too. They never met me before. I'm not that family doctor they've known for 10, 20, 30 years. I'm showing up for the first time just like they are. You have to decide, can I do that? You have 30 seconds to make someone comfortable. And it's based on impression. I have to walk in and look at Rick and say, what are the right words for this person I never met before based on my instinct right away? Right. And I think people self-select well to do that, but you don't get, so you lose this connectivity over time and the ability to tease out how to react and how to develop a relationship over time. But I think you select well to be able to do it. It's actually a fun part of emergency medicine to determine that in that quick moment.
Right. It's to me, it's wild because that is such a, not many people can do that. You know, like even in oftentimes like right now, just speaking, like I'm giving my thoughts serious time to kind of collect and to be able to, you know, navigate a serious emergency scenario that is so layered in complexity because you're dealing with other people that you don't know, you never met, you don't know the circumstances in which they're there, but to have to respond in a way that is to treat them, to potentially save their life and to ease them. I mean, it's impressive. Like that's trying to put myself, because I often listening to these stories, I try to put myself in the shoes of the situation. I would not do well. I would not do very well.
Listen, so part of my job isn't just
I'm in front of here.
Part of my job isn't just doing that for myself. It's to teach other people to do it too, right? So we have residents, we have PAs, we have people who are learning, who are there, and colleagues who are dealing with things for the first time also, and how you help them do that. And I think for me, one of the things I always tell myself, and I try to pass along to the people I'm working with, is even though I've seen this 100 times before, it's happening for the first time to this person. Mm-hmm. So I've taken care of a ton of people with blood clots, a ton of people who cut themselves by accident, a ton of people who had heart attacks or strokes or whatever the problem is. But it's likely not your 100th time. It's likely your first time. So it makes it very special for you. And you have to remind yourself of that. And I think if you do that, it helps you remember where the patient's at, right? Or the patient's family members at. I've told people they have a ton of problems. I told people that say they have cancer. I've had to tell their loved ones of these things. It's part of the job. It's part of the nature of the job. It's not the fun part of the job at all. But you remind yourself that this is maybe not the first time I've had to do it, but it's the first time they had to hear this. And you have to figure out how to do that. And it's a very important, and to be honest with you, an honor to be invited into people's lives in those moments. And it's part of our responsibility to figure out how to do it for you and for our patients, right? And it's really, if you can embrace that side of it, one of the most wonderful parts of being an emergency physician, that you get to help someone in that hard moment.
No, absolutely. And, you know, it's great to hear that there are professionals like yourself in that position to view it that way. Because, you know, oftentimes, I don't know, you know, if I'm ever in an emergency situation, it's hard. You know, I've had to go to the emergency room, and it's hard in those moments to trust somebody while you know they're professionals 100% simply because you've never met them before. But I think hearing it from an individual who experiences it every day, I hope would, you know, help people feel a little bit more comfortable if they ever find themselves in those situations.
Yeah, and I mean, Rick had asked me, we were talking about what my job is like, what my role is like as an administrator, someone who runs an emergency department. And to me, it's very important for my emergency departments that I run to put staff there who feel this way and think this way, right? Because you want there to be some common thread or feeling that when you come back to the same space, that you get a similar personality. And also knowing that people can deliver a message the way I would want to, because I'm now, as the chair of the emergency department, I'm not the one providing care the majority of the time. It's the people who work for me. And I want the way I feel about care to be reflected in what they're doing. So that recruiting and retention part of it and the creating wellness for them really dials back to them being able to deliver that kind of feeling to the people they're taking care of.
Yeah, it's building a culture.
Yeah, and as somebody, I've been to the emergency room plenty of times, a few times in a very, very emergent, traumatic fashion. I've been lucky that I've had doctors that the second I got there, within a few, like you said, within that first 30 seconds, I was like, okay, doc, whatever. Like, I'm okay. I trust you. Let's go. Like, whatever you tell me we need to do, let's start doing. Because without that, I know that my mom, who's usually there with me, right, would have been so freaked out.
Yeah, I mean,
Yeah,
I think part of it is most of the time, most people have not just been a physician, but they've been a patient.
Right.
And you can also, reflecting on that, what did it feel like when I was on the other side of this coin? And what would I have wished happened when I was on the flip side of it, right? Because you want to deliver what you would want to receive.
So
Yeah.
what was one of your more memorable cases, was it very exciting or very stressful, or just something that sticks out into your head over the past few years?
It's really hard because, when you first start, some of the things that people think would be so super exciting in medicine, not for patients to have gone through.
Yeah.
But when you see something where it's like, there was a bad trauma, be it a gunshot wound, when you're a young doctor and you're seeing those things, they're sort of exciting. As you get to be a more mature physician, I think the things that are exciting are the nuanced things that you picked up that you're like, I don't know if someone else would have picked this up. Like that gets a little bit more interesting. And a lot of times the personality types really make the difference of what's going on. It's a really hard thing to answer as far as a particular case in that way. But I just think it's the way you look back and think about it from where you are in your time in medicine, where what might have been so interesting and exciting 15 years ago is not what would be interesting and exciting to me today.
Right.
If that makes sense.
No, absolutely. It's almost like doing something socially, right? Like what you liked to do 10, 12 years ago, maybe you don't really like to, hit the bars or, do this or do that, now.
You find new things and new interests. It's funny explaining, as you were going through that response, I just kept thinking, as you mentioned, like the characters and personalities, someone who stubs their toe could potentially be a more interesting and memorable story depending on the person who stubbed their toe versus, maybe a more serious injury, simply because there are, all walks of life, I'm sure that come into the emergency room.
And sometimes what they need isn't exactly what someone says they need. And you find out what they really need if you can get to know them. If you can make that dynamic I was describing earlier happen, where you get that trust and that information up front, sometimes you solve a different problem for them, right? They came in with asthma, but you solved a different problem. And that's rewarding in a different way than taking care of your first stroke patient, which is so rewarding. But taking care of this subtle thing that's outside the box just changes with time.
So just circling back, you said that you did rotate into Staten Island, and what was it specifically about the Staten Island EDs that made you want to stay here?
And so now your listeners are going to want to turn off this show because I could go on and on and on and on and on and on about this, because it goes back to the heart, I think, of every single thing that we have spoken about. I grew up not on Staten Island. And my family, my parents and my siblings are really just warm and engaging and embracing, nurturing people. And along the way where I was trying to figure out where do I fit, not just in medicine, but to practice medicine. Because patients are patients, right? They come in with the same kinds of things. People get sore throats, they get earaches, they get this, they get that. It just sort of happens everywhere and in every community. But where do I see myself fitting in, not just in medicine, but to deliver that care? And I mentioned when I was a resident, we didn't have our residency in emergency medicine here on Staten Island, and I trained in Brooklyn in a very different setting than I work in now. But I had the opportunity to come to Staten Island University Hospital as a resident for 2 or 3 months of my 4-year residency. And I would say within 2 weeks of being in the hospital, I think this is where I want to practice medicine. This is going to sound planted. I love Staten Islanders. I didn't grow up on Staten Island. There is a sense, in my opinion, of responsibility towards your neighbor on this island. And the majority of the people who work in our institution come from our community. There is half a degree, maybe more, maybe 1 or 2 degrees of separation between people there, and then between you and your patients. And that thread comes through all of the time. And that's me working with my nurse's assistant, my clerks, the other doctors in the facility, and then to my patients. And there's just, you can feel the sense of community. Just, there's a thread that runs through. And that does not exist everywhere. And it felt like home to me in much the way of what my life was like from childhood, and very different from where I had trained, that came back to me when I was exposed to it in the context of medicine. So I was exposed to it in the context of my life, and then I'm exposed to medicine, and then it kind of comes together and gets remarried in one place. And I literally knew that's where I wanted, that I wanted to serve this community.
Now,
at that point.
Yeah.
I know it sounds so funny, but then from my years of being in the department, in the emergency department, and starting as a full clinical person and taking slowly leadership roles and being trained into administration, understanding what my impact would be in my current role, it just became very important. The whole thing started to make more sense and become very important to me, where I do feel I get the opportunity to impact more of our community, more of the people who are being put in front of our community, and what I feel the obligation is, not just to provide safe and efficient and appropriate care, but to do it in the way that we still feel like we're all connected.
Healthwish wishes to thank our very special guest, Dr. Nicole Berwald, Chair of Emergency Medicine at Staten Island University Hospital. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.